Thanks for joining us. We've designed this series of YouTube videos to provide additional details about the Value-Based Modifier program. This program is new to many providers. It started in 2013, but was limited to practices with more than 100 providers. This year, it has been expanded to practices with 10 to 99 providers and is expected to include all medical practices regardless of size in 2015. In this video, we'll provide an overview, focusing on the basics of the Value-Based Modifier program and the steps you need to take now if your practice is impacted in 2014. The second video in this series goes into more depth regarding how the program will determine your Medicare reimbursement in future years. The Value-Based Modifier program, or VBM, is Medicare's pay-for-value program for physician practices. The concept is that practices should be paid more if they deliver higher value and less if they have lower quality and higher costs. To determine value, CMS will evaluate your practice and place you in one of these boxes based on how you compare to your peers. CMS expects the vast majority of practices will fall into one of the white boxes, and there will be no impact on their payment rates. The program is really about rewarding and penalizing the outliers. Unlike many of the other Medicare Quality programs like PQRS and Meaningful Use, this program focuses on the practice rather than an individual provider. Each practice will have a cost score and a quality score, which is a composite of the individual provider scores for that practice. The practice is placed into a cost and quality tier, those boxes that you saw on the previous screen, and the tier determines the payment rate for all physician providers in the practice during the payment year. There are three important points you want to understand here. First, the payment year is 2 years after the reporting year. This means that the performance of providers in your practice in 2014 will potentially impact your payment rates in 2016. Activities in 2015 yield the cost and quality scores that you will see as increases or decreases in Medicare payment on every claim that you file in 2017. Second, the payment modifier is applied to all physicians working in your practice in the payment year, even if they are not working with you during the reporting year. And third, the cost and quality scoring is based on all providers that bill to Medicare under your TIN during the reporting year, including mid-levels, physical therapists, dietitians, etc. However, the payment increase or decrease will only be applied to claims filed by physicians in the payment year. To understand how this program will impact your practice, first identify which column is applicable to you. Be sure to count every provider who submits a claim to Medicare under their own NPI number and your TIN. Note that this does not include Medicare Advantage plans, only claim submissions to your CMS intermediary. If you have fewer than 10 providers, you are not included in this year, but should go ahead and learn about the basics so you know what's coming. If you have 10 to 99 providers, you must report quality measures through PQRS in 2014. If you do not, you will receive an additional 2% penalty. CMS will use these measures along with claims data to determine your cost and quality score and tier. If you're in an upper tier, higher quality at the same or lower costs, you'll see a bump in your 2016 payment rates. But there's no downside or penalty because this is the first year you're participating in the program. There are 2 exclusions from the VBM program. Practices that are not paid on the physician fee schedule, such as federally qualified health centers or rural health centers, are exempt from this program. In addition, any medical practice registered as a participant of a Medicare ACO, either a Medicare Shared Savings Plan or the Pioneer ACOs, are also excluded. So how will CMS determine those cost and quality scores for your practice? Well, it's very complicated and probably requires a PhD in statistics to fully understand. But basically, CMS will use the data from your claims to review your performance on 6 cost measures. They then combine those into a single cost composite score for the practice. They also use claims data to review performance on 3 outcomes measures. These are combined with the performance on PQRS measures submitted for your TIN to create a composite quality score for the practice. These scores are adjusted to account for variation across specialties, geographies, and patient severity of illness. The program must be budget neutral. Practices that are eligible for this program, those that have 10 or more providers, who do not report PQRS quality measures in 2014 at the level sufficient to avoid the PQRS penalties, will receive 2% lower reimbursement in 2016. This is in addition to the 2% PQRS penalty. Practices with 100 or more providers, whose scores for 2014 put them in the red boxes, will have their 2016 payment rates reduced by either 1% or 2%. The money CMS saves from these lower payment rates is then combined and distributed through higher payment rates to practices in the higher tiers, shown in green here. Remember that the tiers are assigned in such a way that 90% of practices will see neither higher nor lower payment rates as long as they report the PQRS measures. CMS will be distributing data reports for all practices regardless of size to give you a sense of what tier your practice would be in had you been participating during the 2013 calendar year. These will be available in the fall of 2014. Unlike PQRS reports for small practices, which have been available by requesting them for individual NPIs, we are being told that these feedback reports will only be available by downloading them for your practice, and that this will require someone in your practice to have an IACS password and be approved for access to these reports. So here's what you should do now about the VBM program. First of all, determine whether it impacts you this year. If you will have 10 or more different providers submitting claims to CMS under their own NPI numbers during 2014, then you need to pay particular attention. If you have 10 to 99 providers, you want to be sure that you report PQRS measures sufficiently to avoid the 2% PQRS penalty. You can report as a group, or if each of your providers report individually, more than half of them must report sufficiently to avoid the penalty. You can get lots more information about reporting PQRS measures through our PQS video series. Because there's no downside this year for practices with 10 to 99 providers, you don't necessarily have to worry about how you perform on the measures you'll submit through PQRS. However, performance, rather than just what you reported, will be an issue for you next year. Finally, you should go ahead and get an IACS password if you don't have one, and update your access to include the QRUR reports. Information on the CMS website about this program is difficult to find. Here's the website. MGMA has done a great summary of the program that you can access if you are a member. I've also listed here the link to MSOC Health's PQRS video series for more information on how to report PQRS measures. Finally, you can watch part 2 of this series to learn more details about how CMS will calculate your cost and quality scores.